No one wants to worry about or even think about bladder control issues, but more than 33 million people suffer from them. So since November marks Bladder Awareness Month, I headed out to see urologist Dr. Joe Carbone in his South Boston office. He tells us how bladder control issues are very treatable.
Bladder has a lot of can have a lot of problems that often present as urgency and frequency, and sometimes urgency and incontinence. Really, it's important to know that incontinence and urgency are not things that you just suffer through silently. A lot of women oftentimes say, oh, grandma had it, mom had it, therefore I'm just going to have to live with it. That's absolutely not the case. Really, what we want to do is have women know that if they're having these symptoms, to get them checked out either with their primary care provider or come down to Southside Urology and Nephrology, and we'll be happy to see you.
And there's lots of different ways to deal with it, too. There's beyond medication, isn't there?
Oh, absolutely. Medication is specific for the patient who has urgency and frequency, sometimes has to wake up at night, with or without incontinence. But there are other patients who may have problems with urinary leakage, with coughing and straining. And in fact, medications aren't beneficial. They're actually counterproductive for those patients. And certainly any patient who has blood in their urine has to be screened for things like bladder cancer or bladder stones or kidney stones, because that's another condition that can cause urgency and frequency and is very, very treatable.
Now, what if somebody's at home wondering, I might have a bladder problem, but I'm not sure. What are some of the specific signs and symptoms beyond the blood in the urine?
Well, certainly if there's any burning when the patient urinates, or if they find themselves wearing pads for protecting against urinary leakage. That's not something that needs to be suffered through silently. Pads actually cover up a lot of problems that can simply be addressed either with medications or simple procedures to help support the urethra, and you don't have to use pads anymore.
And what about treatment if it's beyond the medications, like surgery?
Well, surgeries have evolved over time. There are very simple outpatient procedures called sling procedures that help support the urethra to prevent urinary leakage. There are some more complicated neuromodulation for patients with refractory urgency and frequency symptoms that all can be used to address patients with overactive bladder and bladder symptoms.
And you're actually specially trained in this area for surgery, aren't you?
Absolutely. I'm actually specially trained in female pelvic medicine and reconstructive surgery. It's a fellowship training program that we spend after our residency program to specifically learn about bladder issues.
Now, life and insurance, it's all a lot to deal with. Do you need to go to your primary doctor first before you see you?
No, not specifically. I mean, we do see patients who have urologic issues without referring from the primary care provider. But a lot of times I encourage patients to go see their primary care provider because there's a lot of issues that can be dealt in that office that don't necessarily need to be seen here unless they're not getting any better.
So basically, just don't suffer through it.
Just don't suffer through it. Get it taken care of.
And Southside Urology and Nephrology actually have 3 different offices that you can be treated at in Danville, Martinsville, and South Boston. Give them a call, 1-800-446-9117, or visit them online, southsidedocs.com.